Hello. After BlockBali conference, we have Dr. Richard Satur here, CEO of DClinic, and we have Dr. Robby Thoeng, CEO of VLM, and we're going to be talking about healthcare and blockchain and how blockchain is transforming healthcare industry. Dr. Richard.
So thank you, Santos. So the biggest problem we have in healthcare, and Dr. Robby Thoeng could attest to this, is that most information in the world is siloed. So what that means is we've got information relating to patients that exist in disparate systems. So for example, a patient could exist in a hospital record, a patient could exist in an electronic health record, a patient could exist on their wearable, a patient can exist in so many forms. And the problem is that all that data is siloed. None of it talks to the other data sets. So the problem with that is you've got multiple versions of that patient. That patient exists in multiple versions. So the problem is, how do you get all of those versions together and make it a single record so that, for example, if Dr. Thoeng was to see me, he could get one view of me, and more importantly, get a view that is current, real time, and a view that is longitudinal. And by longitudinal, I mean that none of us have only single encounters with caregivers. And caregivers could be doctors, caregivers could be specialists. In fact, caregivers could even be your family members. It's not uncommon to have family members as part of your care team. So how does Dr. Thoeng now get to see me in a way that helps him to make decisions? Importantly, if I can't communicate my position, so for example, I could be in a coma, I could be unaware of the medications that I take. There could be so many scenarios where I cannot give Dr. Thoeng the right information about me. So how can he now know information about me to be able to make a correct decision, make a valued decision? And importantly, if we could collect that information and not just have it real time, but have it available to Dr. Thoeng and attach alerts, notifications to it, then he has the ability now to actually do a preemptive decision. So that's preventative medicine, which is the holy grail of medicine. How do we make decisions before we have to tackle major issues? And so what we're trying to do in DClinic is we're trying to bring blockchain to that problem. We see blockchain as a way of coalescing all that data, bringing all that data together so that you have one view, a current view, and a longitudinal view, regardless of where the patient is, regardless of which care team member they are seeing, and regardless of where they may be in the world.
So patient could be traveling, for example, you could be traveling to the United States and your record can follow you.
That's exactly right.
Awesome.
It's a portable record, and a portable correct record. Sorry.
And stronger now, what Richard is saying is we underestimate all the people involved in the therapy, in the care of patients. Because mostly doctors, they only get feedback from the patient only. But in case of chronic disease like diabetes, like hypertension, you need information from
family members,
nurses, physiotherapists. So if all these people can
collect at one place.
Yes. And it's not only that, but it avoids second, third examinations of expensive medical treatments and examinations. Yeah. And above all, the patient will be in control of their data. They own the data. While now, if patients requires their medical record because they want to ask for a second opinion, it's a hell. They won't get it while they have paid for it.
Of course, and also if there's not enough historic data, they won't be able to get the second opinion in a proper way.
True.
But if you have a history of data, of, for example, 10 years of history, or whenever that history starts, that will definitely value add for another doctor to look into and find the history of the patient and be able to provide a better care.
Not only that, we are going to link specialists from all over the world that can look into the data. You don't need to travel to the US in order to get a second opinion.
Yep.
So
send your data
or by telemedicine. So there are so many advantages of blockchain connected to healthcare.
Awesome.
And I'm an Indonesian, and as for Indonesia, I've seen that too many doctors are so attached to their medical data of each patient that they don't even record it in a computer. They just write it down. Can you imagine?
So there's no history maintained.
So suppose something happens with you in the middle of the night and the doctor is not available.
What do you do?
What do you do? Everything will be redone.
Needs to be redone. If you need some certain scan, blood test or something, there's no, for example, ECG.
No.
It's a historic data is always helpful.
True, and Indonesia is still a developing country. We have top hospitals. However, I always preach we have to do this step by step. And in fact, medicine can be so simple by using our senses without those expensive tools. But blockchain can help in this.
So you can have
making doctors and caregivers like nurses more aware about the cost of every intervention.
You know, there's been so many studies that have been conducted around the world. You know, one of the biggest fears that doctors in particular have, is they're terrified that if the patient can see their record, that somehow that takes away their power. And in fact, studies have very clearly, that's right, this need to, no, it's mine. Well, no, it's not. It's actually the
patient's data.
Patient.
Yeah.
If anything, it's shared data.
Yes.
And that's really important to understand, that a patient's record is actually a shared data source. It's not, yes, a lot of it is owned by the patient, but a lot of it is also owned by the individuals that touch that patient. Now there are many studies that have been conducted over the years which clearly show that when doctors have feared patients getting access to their record, that fear very quickly dissipates when they find the value that they get from allowing the patient to access.
For the benefit of patient.
For the benefit of the patient. So the initial fear, yep, it's there, but the studies clearly show that in a very short period of time, the studies show overwhelmingly that doctors will then encourage patients to get even more access. In fact, one of the beauties of blockchain is it also allows the patient now to contribute to their record. And, you know, we already know the growth of wearables in the world.
Of course.
Your watches, your individual devices.
Fit devices.
The fit devices, the, thermometers, the reading your blood pressure, etc., etc. All these things now exist. Heart rate monitors. All of these things now exist. The thing is, patients can do all of that, but where do they put it? Where does this data go? Invariably, what happens is a lot of it coalesces again back onto their laptop or into the cloud, and that's where it sits. It doesn't have the benefit of flowing back into the record, and blockchain allows you now to grab that data and put it back into the record where it actually makes sense.
I agree with you. I look at my phone, it collects, how many miles I have walked in a day, or how much I have run. But the data goes nowhere. I believe that data is shared with the doctors. They will know how healthy habits I have or not, right?
I can add something more. One of the most threatening our world is the non-communicable disease. That means cancer, hypertension, diabetes, Alzheimer, name it. So disease that cannot be transmitted, okay? The yearly burden is going to be
Tested.
$47 trillion
For the
for the world community.
to solve the problem.
So as for Indonesia, it's going to be 4.7 trillion. So if we don't pay attention
Now.
on prevention now and using the right tools in order to measure, to collect data, to store data, we are too late. We cannot cope with it anymore.
Correct.
So correct.
And the answer is prevention. With curation, you're too late.
I so agree with you. I notice that cancer patients don't get treated just because there was not enough tests done on time. They come at the latter stage, like a stage 3 or a stage where nothing can be done.
Yeah.
And as a cancer patient or as a cancer doctor, all you can do is add few years at that time or a few months.
Yeah.
You know, but of course, I agree with you. If the preventative medicine or treatment has been there's opportunity to test or detect before time, and there could be more help to the patient's health or even treatment.
Well, Santos, you just said earlier. You said you have healthy habits. You do exercise. So, using blockchain, why can't I communicate that back to an insurer? That's a positive for the
That will reduce my insurance cost.
Yes.
That's exactly right.
Yes.
And why would the insurer look at that as a negative? The insurer still gets their premiums, admittedly at a lower cost, but they're also insuring someone who is fit. And so from their perspective, they get a double benefit here. They get to have the ideal client. I get to collect money from you, and you're doing all the right things. Now, add one more level to that. Why can't the insurer then additionally give you advantages if you were to do more, or if you were to adhere to that care plan? And care plans are really interesting. What dClinic has done is it's not only working with a blockchain. What it's done is it's developed a healthcare platform around the shared care plan. So what's a shared care plan? The idea is that patients don't just see doctors. Patients see many people that influence their health. It could be dietitians. It could be specialists. It could be laboratory. It could be pathology. It could be family members, all right, especially for aged care, at home, for example, and things like that. So there are many touch points in a patient's care, or what we call a care plan. So the idea of blockchain is it's now shared. It becomes a shared care plan. So once you have all of those people influencing, then all of them can also then get rewarded for that good behavior. So for example, if you were to be a bit too relaxed and you decided to go a couple of weeks without doing your exercise, I might be a family friend of yours. I may give you a tap and say, hey, listen, Santos, why don't you get back into that 20 minutes of walking a day?
Yeah, look better before. Why not? Why have you changed the style or something?
And then why can't I be rewarded as part of your care team?
That would be awesome, I would believe.
Now, what that does is it teaches me good behavior as well too, because now I'm contributing to your health. The outcomes of doing something like that is that you've got reduced health costs. The actual benefit to governments and organizations is clearly demonstrable. You've got people that are being more healthy, and you've got people that are doing the right things to help people be healthy. Now, I've also heard the argument, well, what if you have chronically ill people? And you're right, chronically, you can't save everyone. You can't make everyone magically healthy.
No, in medical terms, as doctors like to say internally, like how many months or years you can add to the patient's life.
That's right.
Patients may not like to listen to that, but that's the reality.
And
the reality is how many years you can add.
I could add something more. My philosophy is and my tagline in my company is add life to years. I want to improve the quality of life.
Yes.
Not at any price. You cannot extend life at any price. There's also still the people's choice. And you have to weigh. I mean, our society in the Western world, in Europe, in the US, it's going too far that we want to extend lives at any price. Well, never patients are asked, what do you want? If you ask me as a doctor, I care for the quality of my life. I know I'm going to die one day.
Everybody does.
Everybody does. But whether it's at 87 or 78, I don't care. As long as
How well you are.
As long as my first 78 is fine. It's like cancer patient. Nowadays, people don't die from cancer anymore. Most of them become chronic patients. You give them the proper treatment, evidence-based treatment, and let it flow. Don't intervene too much in nature. And science is there to help, but not until the end. And that's something that we need to consider also as doctors, that look always at the quality of life of people. And this is what Richard is preaching, that by having this shared care plan, you involve everybody into this system. It looks a little bit childish by, I'm going to reward you, but in a sense, it's like that in the daily life.
No, I like that. Actually, when I heard about reward, I was like, it's inclusion of family members and friends, and having their stake into that. And the idea of reward is great, I believe. Like, and if you can do well, I'm getting money for that, or some reward for that. That is awesome.
And it applies for chronic patients, not only for healthy people.
Anybody and everybody.
Because chronic patients have to be motivated every day to go through their treatments. Like a diabetic, I mean, that's a burden. That gives this reward system, give them a new hope for better. And yes.
So Robby, let me ask you this. You have been doing this D-Clinic, and what are the roadblocks you have seen? Like, there must have been initial roadblocks when you started that, like, it's a perception of people or even doctors, they don't want you to get too close to their business or things like that. Yeah. So what are the roadblocks you have felt?
Well, so probably the largest one in the last maybe 12 months or so is that blockchain has been associated with cryptocurrencies. So that's been an enormous block. And the reason is that one is a technology. Blockchain is a technology. Cryptocurrency, that's an application on the blockchain.
Correct.
And so, we've done a very poor job. I would argue that the blockchain community has done a very poor job of explaining what blockchain is. They've allowed it to get caught up in the hype of cryptocurrencies. The thing is that I still think that cryptocurrency has a great role to play in this. It's a beautiful reward mechanism. The thing is, you don't want to make it a solitary coin. You want to make it any types of coins. So I'm a bit of an evangelist to say, the cryptocurrency is a great way of rewarding patients, as is real money, as is memberships, as is loyalty programs. All those things make sense. But open it up to everyone. Be inclusive. And so, for example, one of the biggest issues we faced in healthcare is interoperability. Things just don't talk to each other. And they don't talk to each other because no one's had a reason, I guess, to have it talk to each other. Now, blockchain forces that issue. The other roadblocks we've had is that there's been this idea that blockchain is somehow corruptible. It's easy to get into. It lacks security. In fact, it's the exact opposite. It is the exact opposite. So I think there is a whole level of education that needs to occur. And D-Clinic is doing that. So D-Clinic, in partnership with VLM, is saying, you know what? We get that. We get that there are some roadblocks. We understand that there are some problems out there understanding how this technology works. So what we are going to do is we're going to come to Indonesia. We're going to set up the clinics. We'll institute the blockchain. We'll institute the healthcare platform. Dr. Robby Thoeng will then apply the services, the qualified clinical services around it, and we will show you. We will be the beacon. So you don't have to take that risk. We'll take the risk on your behalf, and we'll show you that this actually works.
And not only that, we don't just apply this for the total healthcare system. We made our own medical concepts, like vitality, like specialistic care in cardiology, oncology, and orthopedic. We have one-day care. We have retirement connected with medical center. We have rehab center connected with medical center. We have occupational health, and we have clinical trial services. All with the view that this is how you can grow healthcare according to the need of this society. So there's a saying, you have to crawl first before walking.
You can walk, yeah.
And I think after studying the market, this is what we need in Indonesia. Not only Indonesia, a lot of countries would need this.
Of course, you can
Because
replicate the success in different part of the world.
The investments are lower. It's going to be more efficient. You don't need to have the large numbers of caregivers in a big hospital. No, you can
manage that well.
Manage that well. So that's, yeah, it's the medical concept together with the blockchain is going to be revolutionary.
Well, I think the other thing is that care is not about just being in the facility. You know, very often I get asked, so this is only going to benefit D-clinic patients. That's not correct. D-clinic patients or the D-clinic facilities is one touch point in a patient's journey. In fact, these patients can exist anywhere in the world, and we can apply treatment, for example, through telemedicine, as you mentioned earlier. We can apply treatments and strategies to help them in their care, regardless of where they live in the world. And because we're talking about a care team, and because we're talking about shared care planning, it immediately means the patient can be anywhere. They don't specifically need to come to Indonesia. They don't need to specifically come to a D-clinic. Having said that, D-clinics are going to be instituted all around the world. That's our game plan.
So you're going to partner with other care providers and allow them to use your services and your products to extend that software and take better advantage of and participate in the larger ecosystem.
And that's exactly right. In fact, you yourself, with the services that you offer, and I can ask you this question now, is that, you know, we are going to have to set up a secure hub or hubs in Indonesia to cater for our D-clinic solutions. So the question back to you would be, you know, how do you see that working? What do you see as, you know, your role in this partnership to be able to provide those secure hubs so patients and clinicians and everyone from that matter, including governments, know that the data is going to be secure, that the data is going to be quality controlled and pass all the necessary regulatory and consent regulations for Indonesia and in fact the world, but certainly in Indonesia initially.
Of course. So when we talk about infrastructure, it's also infrastructure embedded with software. And also when we talk about global services such as D-Clinic, we need to look into the perspective of like compliance, you know, the patient data, who has access to data. So we provide an ecosystem, an infrastructure system, a cloud-based infrastructure, which can be extended. Underlying security is embedded in there, that the data is protected. And essentially, when you talk about blockchain, it requires a lot of processing capacity.
It does.
You know, when you're bringing data from across the world, how do you manage that? You know, and certain data needs to be available. For example, you know, a patient is being seen by a doctor or actively being seen by a doctor. That data needs to be into the memory, you know, for the faster access. You can't expect to be a data which is sitting in silos somewhere and say I'm from the United States and I've been using services of D-Clinic. I flew to, say, Australia or somewhere. You know, my data needs to follow me, so the data is accessible quickly. We allow our infrastructure to complement that by highly customized hardware solutions which can plug into your software and enable you a faster services. So if doctor is waiting for a certain data, doesn't have to wait for too long.
Yeah.
Because it adds to the frustration, and that is the key.
Yes.
We help you remove the frustration.
Yes.
Service at right time is the key. So when you are able to render a service, we're able to help you plug in there to help you achieve your goals.
And especially if we're going to, in our case, we're not using a third-party blockchain. We've actually built our own dedicated healthcare blockchain. Now that comes with a lot of overheads. So we need to trust a system. We need to have that validity of that system, especially when we're talking about a hybrid model. And that's what our blockchain is. It's a hybrid model. So why did it have to be a hybrid model? Well, because clinical data by nature is extremely fractal. People think of a blood type or a blood group, and they say to themselves, well, isn't that just a letter? Isn't that O positive? Isn't that AB? Isn't that AB negative? And the reality is that's just such a small factor of what makes up a blood group and what makes up a blood type. It's just there's so much additional metadata around it. So clinical data is extremely fractal. So that's the first problem we have. The second problem we have is that regulations change from geography to geography. And so the regulations that we will see in Indonesia are not going to be the same as they are in the US,
of course,
or in Australia, or in Brazil, or anywhere for that matter.
That also complexity of how you manage the data.
That's exactly.
A patient from Australia or the data needs to conform to the health compliance needs of Australia, and similar in the United States as well.
Yes.
The needs are different and it's complex.
I think it's interested in the Indonesian market to implement their system is also the universal health coverage has been established 4 years ago.
Wow.
So it's just a baby. Okay.
Nascent stage.
Yeah. So now Indonesia has 275 million
Population.
and by now 149 million are enrolled. So the plan is by 2000 and 2019 everybody will be enrolled.
Insured.
Okay, so the implications of the budgets and things like it's all new for the government, and players like insurance companies, they're all flying in because they see big opportunities there. I told you about occupational health. We have 170 million registered workers.
Health workers?
So, yeah, so that means just on occupational health, workers, they get sick or they're absent. They have to be paid while they're sick. Employers insure that, okay? So there are so many players going to be active in the
ecosystem.
In that ecosystem that makes this only for that only they need blockchain, because no system can handle that with 170 million people.
Of course.
Yeah. So now the government realized, hey, we never are able to cover every illness, the duration of the illness. They have to readjust that. So only that I see, wow, that can only be solved by blockchain and by patient healthcare. Yeah.
And what about medical tourism, Robbie?
Oh yeah.
That's a great aspect, yeah.
That's a massive market.
Yes.
Medical tourism is a growing market all around the world.
And not only that, why am I mentioning Vitality? Vitality only is a $4.2 billion business every year. 4.2 trillion, sorry, $4.2 trillion. Okay, and Vitality is prevention, in fact. It's wellness, it's well-being, it's anti-aging, it's beauty. I always say, medical tourism, Indonesians, we cannot think in getting all kind of pathology to be treated here in Indonesia. Why? Because there are other countries who are more specialized.
Of course.
If you have a heart disease, why would you come to Indonesia? Okay, but let's say aesthetic surgery, we can do that. Dental, aesthetic dental, we can do that.
At a lower cost.
Orthopedic surgery, we can do that. So I don't think, because sometimes I hear the news, we have to stop the medical tourism to Singapore, to Malaysia. No, it's
That's an interest of patient.
Yes, I think let the patient choose, okay, where they feel comfortable. And
safer.
we as service providers, we have to show what we can. And this is what we're trying to do. I said, rather than stopping, letting other foreign people coming here, why don't we just try the people that goes to Singapore or to Malaysia, try to convince them, hey, we can do as good as here in Indonesia for certain pathology, not everything.
Yeah, for certain specialization or certain specific skill set, you can definitely prove over the time that you have a option you can trust within Indonesia.
Sure.
And then that would be great for local people at a reduced cost.
Yes.
And absolutely. And these patients, when they get on that airplane, their record travels with them.
Yeah.
I mean,
Just with a phone or just flip of a button.
that's exactly right. They don't have to worry
I
about
consent.
That's it. And you know, the consent model, there are two really important points here. I mean, the consent model is part of the regulatory, is not quite part of the regulatory framework of government to government. And that really is the consent of the patient and the caregiver. So again, that blockchain model, in order to work, and why I say it has to be hybrid, needs to also encompass the idea of consent models. So of course another huge advantage of blockchain is for the pharmaceutical companies. So let's say a patient stops taking their medications, alerts, the system will automatically start to alert the right people. So here's where blockchain becomes very, very powerful. Why would an insurer not want their patients to take their medications? So that's a positive outcome. In addition to that, let's say that drugs change. Then once again, pharmaceutical companies can alert care members, they can alert the patients. So these are real positives that come out of having a blockchain type arrangement around healthcare. And so I think, you know, the partnership, I think, between the three of us, the fact that, you know, we have a platform that is blockchain enabled, we have a healthcare platform that then sits on top of that is interacting with the care team and absolutely works around the care team. The fact that we can supply infrastructure that very clearly will meet the needs from a security perspective, from a regulatory perspective, from an on-time perspective, from a quality assurance perspective. And the fact that we've got a partner that can deliver the clinical expertise and the clinical know-how that is going to help these patients to have quality outcomes, to really tackle the holy grails of preventative medicine. I think the fact of the matter is, I think this is a partnership that will absolutely shine a beacon, and I think Indonesia is ripe for it, and the rest of the world better watch out and see what we do.
Of course.